At Mahajan Medical Center, we care to listen to our patients. Proudly serving the needs of Tampa Bay in primary care for 25 years and counting. The topic today is introduction to stroke and what can we do. All right, so what is stroke? It's interruption of the blood flow to the brain, resulting in damage to the brain cells. So it's very simple. It's like heart attack in a way, and you will see a lot of commonality in the risk factors as well in strokes and heart attack. And it's very similar as you get a heart attack, as you know, with blood flow getting interrupted. Same way the brain blood flow get interrupted and you get damaged brain cells if it's been interrupted for long enough time and they don't recover. And that's what we're going to talk about. The time is the essence.
Yeah, so I was going to add, interrupting the blood flow, the common factor there is that there's no oxygen to the brain cells. Now, without oxygen, the brain cells die, and that's what a stroke is. So it's brain cell death because of blood flow interruption.
All right, so that tells you why we are bringing this topic for discussion today, why it's important. And Dr. Totah brought this slide with him, and it's very profound. If you look through it, every 40 seconds, someone has a stroke. Every 4 minutes, someone dies from stroke. And if you look at how many people get diagnosed with stroke, is almost 800,000 people, and 77% have the first time or newly diagnosed. And that's a good point that, the stroke could be mini stroke, and we'll talk about that in a minute. And that could be a ding dong bell that major stroke is coming. So you got to pay attention to your risk factors at the time. If you God willing, get a mini stroke and get away without any damage. The last piece, what's up there, is very disturbing too. It's the third most common cause of death, and predominant reason is disability.
That's an error, Dr. Mahajan. The stroke used to be the third most common cause of death at one point, but it went down to the fourth most common cause of death until 2020. Then COVID last year, it went down to the fifth most common cause of death in the United States. After COVID displaced it for the number 4 spot. And the top three being heart disease, cancer, then unintentional injuries and accidents, and then COVID for 2020, then stroke. But worldwide, stroke is the second most common cause of death. So very, very heavy burden and very important condition.
So what are the common signs and symptoms? What should people look out for? And we see people think of stroke being just the weakness on one side, and which is important to know, but it could manifest in other ways too. I saw a patient last month with severe headache, and she won't let me turn on the light in the exam room, and I got very worried because she has high blood pressure. So I sent her to the ED, and it turned out to be a stroke, and we'll talk about what kind of stroke she had. But yeah, so getting a severe headache, the worst headache of your life, and if the light bothers you, could be a stroke as well. So not just the typical classical presentation where your right side or left side of the face is drooping, and you're not able to walk because your legs are not moving or your arms are not moving. Those are important symptom, but we forget sometimes it could be numbness, it could be headaches, could be trouble walking, dizziness, loss of balance, poor coordination. And then if it affects your eyes, then it can cause trouble seeing. And if it affects non-motor areas, it can cause confusion and memory loss and things like that too.
Any bodily change, functional change, is a potential stroke. The most recognizable signs are loss of speech, altered speech, the facial droop, paralysis or numbness, especially one side of the body, but also dizziness, sometimes unexplained dizziness, vertigo, even hearing loss sometimes, if it happens suddenly, it could be a stroke. So the take-home message is that if your body is not functioning normally, you notice a change in your loved one, that's a potential emergency.
If you look at the population, Abe, and you see all that population in Pinellas County, which is tend to be on an older side, and you look through their medical history, and they have most of these conditions. Unfortunately, the hypertension, which, as you mentioned is a silent killer, does not give you any symptom till you're too late into the game. So it's very important to, anytime you're going by Publix, if you have family history of high blood pressure or any other pharmacy or gym, get your pressure checked, or at least go to your primary care once a year at least, to get your full physical done, to check your sugars. And that's the next big killer. The diabetics get more strokes. So if you have family history of diabetes or you're on a heavy side, you could be new onset diabetic too without the family history. So it's important to do once a year physical to catch if you have high blood pressure. As highlighted here is a silent killer, so you may not get any symptoms. Till you get a symptom of stroke, then it's too late. Same thing with the diabetes, unless it's super high, the sugars may not give you any symptoms. If it's super high, we call it polydipsia, polyuria, polyphagia, which is means that you get excess appetite or excess urination and excess, sensation for thirst. But that we're talking when your numbers are super high, and you could have subtle um, type 2 diabetes and not know without checking your fasting sugars and A1C, and urine can give us a clue too. And then the age, as we just alluded to, that older you are, more the the plaque buildup in your arteries, more the risk of the irregular heartbeat, what we call atrial fibrillation, is more prevalent, is the most common arrhythmia with the older age group. The next risk factor is diet and lifestyle. If you are living off McDonald's and Burger King and KFCs, then sign up for frequent flyer miles with Dr. Totah. He has that program for TIAs and stroke, buy one, get one free. So, more processed food you consume, more your risk is of, unfortunately, getting heart attacks and stroke. Again, we're bringing the same thing over and over again, and because the body does not differentiate which artery, whether it's your artery of the heart, artery of the brain, artery of the belly, artery of the leg, they all get disease from head to toe. So, though we, go in our cells and talk about strokes and heart attacks separately, they're big fellowships and specialties, but end of the day, the risk factors are all same. Lifestyle, again, lack of mobility, lack of exercise, lack of motion is a big risk factor. Genetics, again, if you have someone in your family, early onset strokes or TIAs or heart attacks or poor circulation, you're high risk for strokes. Smoking, again, that's obvious, is very hard for people to quit, but it's one of the biggest thing if you want to take home from today's talk is improve your diet, walk more and not smoke, and you will reduce your risk of stroke and heart disease big time. And then we talk about heart disease and the atrial fibrillation kicks in. So the atrial fibrillation is irregular heartbeat, and the blood does not move in your left atrium, and then it can throw a small clot to your brain because the blood is thick at the time, and that's a serious, common arrhythmia or irregular heartbeat of the heart. So if you're feeling that you're getting palpitations and irregular heartbeat, it's good to see your primary care or your cardiologist, get a EKG. And these days with the Apple Watch and the pulse oximeter, it's very easy to diagnose. You will see your pulse is like 78, 120, 80, 110. There is no pattern. That's atrial fibrillation unless proven otherwise. So you can really get a simple device like a pulse oximeter, which in COVID era is a good tool to have anyway, 30, 40 bucks. You can get it from any of your local pharmacies, and you don't need to get high-tech Apple Watch. And that can give you not only the oxygen level, which is nice, but also give you an indication for whether you have irregular heartbeat or atrial fibrillation. Last not the least, not as common in the older population, but more common in the younger population, but can happen at any age, is recreational drug use. Sorry I stole your limelight, Abe, but is there anything
No,
else?
you're good. You're doing an excellent job. You can keep going. But I'd like to add a couple of things. The risk factors mentioned, high blood pressure, diabetes, and so forth. These are primary risk factors, but I also want to emphasize that of the 800,000 people with strokes every year in the United States, 200,000 of those are recurrent strokes, patients that have had strokes in the past. So that's why that's a quarter. That's why it's very important, primary care and family medicine. It's very important for the patients, the stroke patients, to follow up with their doctors and treat their risk factors and make sure they're taking the medicines they're supposed to be on to prevent strokes.